A new addition at Kern Medical is 104 here in California, and it's transforming surgeries.
Eyewitness News reporter Hannah Baton gives us an exclusive look at the doctors and a patient who helped pioneer the new technology. Hannah?
Well, Dave and Rochelle, when Kern Medical patient Nicole Mays was growing up, her mother battled several recurring cancers and had multiple invasive surgeries. Now Mays is fighting a battle of her own after finding a tumor on her kidney. When a health condition takes its toll, you listen to your doctor and sometimes also your nerves.
But once I found out I had a tumor, yeah, it freaked me, it scared me, because I'm thinking, okay, now I'm about to have to go through probably the same stuff my mom went through.
But for Nicole, a new member of the Kern Medical team made her experience much different than her mother's.
The robot? Now how's this robot going, how's this going to work?
Nicole is the first patient in Kern County to undergo a procedure with the center's new multi-million-dollar robot.
The memory of it looked like something from Star Wars.
The robot, dubbed the Da Vinci Xi at Kern Medical, may be named after someone from the past.
Now move the operating table while Da Vinci is docked.
But it's transforming procedures into a thing of the future.
This same operation, if this were done 20 years ago, even 10 years ago, the patient, Ms. May, she would have had to have had an incision basically cutting her body in half. We would have had to remove the 11th rib. We basically would have used retractors to hold everything out of the way.
With the robot, doctors only had to make 4 incisions less than the width of a pinky each, reducing patient bleeding, post-surgery pain, and recovery time.
We've had some patients do extraordinary things just a couple weeks after surgery, and sometimes that's actually a downside because you don't have that pain reminding you to take it easy.
I mean, I only stayed a day. So, yeah, it was like I had my surgery one morning, the next morning I was going home.
When performing surgeries like May's, a bulk of the work isn't done on these operating tables, but rather here at the console, where doctors can utilize these finger grips and foot pedals to simulate real human movements.
It's taken a surgeon who has 2 hands and it's made you into a 4-handed surgeon.
It's also transforming surgery by giving doctors a look into the patient at the tips of the tools.
You have a camera arm, which the surgeon has control of.
The Kern Medical team has since performed hundreds of procedures using the robot, something that many patients say is a better alternative.
Versus just having a gang of doctors around me, cutting on me, removing ribs and everything else. I'll take the robot surgery any day.
Da Vinci is shutting down.
Now, if you want to look at the new technology, there is an open house at Kern Medical. That's October 5th from 4 to 6 p.m. and it's open to the public.
So the surgeon controlling it isn't actually at the operating table then?
They're not, no. All of the work with the surgery is actually done at the console that you saw there next to the operating table. So in theory, the actual surgeon doesn't need to be in the room, city, or even the same country. It can pretty much just be done remotely wherever that console is.
Oh,
pretty cool.
Yeah, all right. Thank you, Hannah.